So we're not trying to be gross and showing you this, but it's also kind of to dispel the myths that a rectal examination is a scary thing. It's not. Is it pleasant? No. Do women like having pap smears done? No. So men, this is the time where you have to understand that for these brief 10 seconds, it can change the outcome of how your life proceeds. Because again, like I said, you get it early, it's curable. And that's what we want from this conversation. We use a glove. We have you either leaning over the exam table or laying on it, depending on the preference of the patient and the doctor or the provider. And we use a lubricant, so it's not going to hurt. And what we're looking for is the size of the prostate. And then we're looking for lumps and bumps. And sometimes a person like Dr. Zhu or the internal medicine doctor might feel a bump. Now, your prostate should be small, the size of a walnut, and it should not hurt, and we should have no lumps and bumps. Smooth is the word we're looking for. So if there is anything that seems odd, that warrants another discussion and another follow-up. Okay, so I want to make that clear that it's important to know what it is we're looking for. I run health fairs and I go out to the community and we have this little prostate model. It looks almost like a plastic thing where this is a normal prostate, this is a big prostate, this is a cancer prostate. And the amount of guys that come up and try to feel that, they're in shock at what a bump or a lump feels like. They're like, well, how can we know that it's there? Guess what, guys? You're not going to know. Only I can feel it, or your doc can feel it, because you won't feel it. It's not symptomatic. The only time you're going to feel it is if your prostate is huge, and then you can't pee. If it's really big, you can't poop too easily either, or your sexual activity is compromised. So it's really important to know what's happening with your own body.